Welcome to our presentation on performance-enhancing drugs. What are performance-enhancing drugs? Well, performance-enhancing drugs are drugs that are intended to enhance performance and give people a physical advantage. There are 6 different categories of performance-enhancing drugs, and each of these types of performance-enhancing drugs also have their own uses and side effects. These 6 categories of drugs include stimulants, narcotic analgesics, anabolic steroids, beta blockers, diuretics, and peptide hormones and analogs. So first off, we have stimulants. Stimulants are a category of performance-enhancing drugs that increase alertness, reduce fatigue, and may increase competitiveness and hostility. While stimulants do have performance-enhancing effects, common side effects include anxiety, insomnia, increased heart rate and blood pressure, dehydration, stroke, heart irregularities, psychological problems, and even death. Next, we have narcotic analgesics. They are a category of drugs that are intended to reduce pain through psychological stimulation. The sole intention of these drugs is to reduce pain. However, they also include a large number of side effects. So starting off with constricted pupil size, dry mouth, heaviness of limbs, skin itchiness, suppression of hunger, constipation, inability to concentrate, drowsiness, fear, anxiety, and physical and psychological dependence. Next, we have anabolic steroids. They are derivatives of the male hormone testosterone. These drugs are intended to increase strength and endurance, improve mental attitude, and increase training and recovery rates. But not without risk, and associated with this drug is increased risk of liver disease and premature heart disease, increased aggression, loss of coordination, and a variety of sex-related effects, including infertility in males, and then male sex characteristics in females. Next is beta blockers. They are a type of drug that is used to help lower blood pressure, decrease heart rate, and block stimulatory responses. Some side effects that can develop while taking beta blockers are excessively slowed heart rate, heart failure, low blood pressure, lightheadedness, depression, insomnia, weakness, nausea, vomiting, cramps, diarrhea, bronchial spasms, numbness, and tingling. Next, we have diuretics, which are a type of drug that help eliminate fluids from the tissues and increase urine production. Athletes may decide to take these types of drugs because they result in temporary weight loss. Although diuretics may be a quick solution to quick weight loss, the side effects included are increased cholesterol levels, stomach distress, dizziness, blood disorders, impaired cardiovascular function, and decreased aerobic endurance.
Peptide hormones and analogs. Peptide hormones and analogs are chemically produced drugs that have similar effects to pre-existing drugs. These drugs are used to increase strength, endurance, and muscle growth. Like all other performance-enhancing drugs, peptide hormones and analogs have a large amount of side effects, including increased growth of organs, heart disease, thyroid disease, menstrual disorders, decreased sexual drive, and shortened lifespan. Why is it important to know the side effects? As a player or coach, it is important to be aware of the side effects of different types of performance-enhancing drugs. This can help an athlete or coach identify a player that may be taking drugs and allow them to provide some guidance in a better direction. Why do people resort to taking performance-enhancing drugs? To gain a competitive advantage. Many athletes are competing for prize money, sponsorships, endorsements, and contracts. This means some athletes will try anything to gain a competitive edge over competitors. to gain social prestige and be acknowledged for their abilities by others, and for their internal satisfaction of achieving a high level of performance. The consequences of taking performance-enhancing drugs. Legal sanctions such as fines, suspensions, and jail times. Social sanctions such as disapproval and criticism by important figures. Self-imposed sanctions such as guilt and reduced self-esteem. And lastly, health consequences. Prevention and treatment for performance-enhancing drugs. Substance abuse is a clinical matter, so people such as coaches and trainers. Next, coaches and fitness professionals can provide resources to athletes about the effect of drugs. This approach has not been proven too effective, but is still necessary to take. Actions speak louder than words. As a coach or leader of a sports team, it is important to set a good example by avoiding smoking, alcohol, and/or drugs. The most effective approach to reducing and preventing the amount of athletes that take performance-enhancing drugs is to enforce mandatory drug testing in sporting leagues. Next, our group has a short video about Lance Armstrong and the performance-enhancing drugs that he took. To end our presentation, we have 3 questions for you guys. In the video, which types of performance-enhancing drugs did Lance Armstrong admit to taking? Secondly, why would Lance Armstrong take these performance-enhancing drugs? And finally, what sort of repercussions did he face after being caught? Thank you guys.